Today I have two guests from Siemens Healthineers. They took me into a world that I could only imagine. Using technology, they can build a digital twin of a key component of a hospital, and using virtual reality, a client can walk through it, all within about 3 months. They're not just rolling out healthcare, they're transforming healthcare using technology around the world. Today I have two guests with me, Renas Rechid. My other guest is Natalia Korchakova-Heeb. Renas has a degree in medical informatics and has spent over 30 years in the healthcare industry. During this time, he's gained vast experience in both line and project management, covering, among other things, e-health, hospital PPP, radiology, and laboratory operations. Renas is passionate about transforming care, which can be delivered to healthcare providers to increase value. He's in the ideal position as the global head of sales enterprise services, Siemens Healthineers. He has the ideal role in which to blend his experience and passion. He's responsible for driving the positioning, outreach and sales skills to improve access efficiency and value in healthcare through long-term partnerships. My other guest is Natalia Korchakova-Heeb. Natalia is a global citizen. She's studied or worked in the Ukraine, the US, Hungary, France and Germany. And for a period she was with the European Commission, and she's fluent in several languages. Her entrepreneurial skills came through in 2019 when she founded PPP Health for All, a global platform to facilitate preparation of sustainable PPPs in the healthcare sector. In 2021, Natalia joined Siemens Healthineers, where she is currently leading PPP operations. She's also very passionate about sustainable development goals, and in particular SDG 3, health and well-being, and SDG 17, partnerships. She's also on the steering committee of the World Association of PPP Units and PPP Experts. She also is a certified expert for IFC Edge certification for green buildings. I think the combination of Rena's leadership, Natalia's experience and Siemens' global commercial strength suggests there are very exciting times ahead for sustainable healthcare. So I'm delighted to welcome them to my podcast. Welcome.
Thank you for the introductions, Richard. Nice being here.
Thank you, Richard.
Natalia, could I start with you?
Yes, sure.
I'm aware there's two sort of global challenges. There's the UN's 17 Sustainable Goals, and the fact that the global public sector can't afford all the infrastructure projects it needs. These could be insoluble, but one solution clearly is to engage the private sector using PPPs. And with your experience of looking at PPPs over a number of years, is this a long-term sustainable, equitable solution, or is it really a short-term stimulus?
Well, first of all, thank you for this excellent question. And cooperation with the private sector is a key to a sustainable future. So I strongly believe that public-private partnerships are a long-term solution. And this is absolutely unique modality because private and public sectors working along each other for long period of time and implementing jointly a vision. And Siemens Healthineers over last several decades was engaged in various PPP projects around the world. And we've seen what a profound impact those projects have made on healthcare, and also collected very valuable experience on strengths, on challenges, and how to focus our expertise to create a bigger impact. But at the same time, Richard, I want to say that PPPs could and should be also seen as the short-term stimulus to achieve sustainable development goals by 2030. We are missing targets. We are behind, right? We were also pushed back by pandemic. So while PPPs are not a panacea, of course, it's just one of the tools amongst many. We have to consider all the options and use all the options available, and PPP definitely is one of them. And there I also want to say that it's not about the number of PPPs and volume, but also to make them align with sustainable development goals and make sure that there is a measurable impact. And it's not about public sector, but also the private companies who are engaged in public-private partnerships. They should be aligned with sustainable development goals, and I say at least they should be members of UN Global Compact.
Thank you. That's very interesting. I'd like to come back, I think, a bit later on in our conversation about missing targets. But Renas, how are Siemens Healthineers responding to the UN SDG agenda and PPTs? What do you actually have? What are your plans? How are you involved at a detailed level?
Thank you for that question, Richard. It's important to have that as part of our way to do the business. So the environmental goals, the agenda with the development goals, what Natalia was already referring to, are strongly supported with the way we drive the business. For example, core to us is that we increase access to care in many countries. Many countries, I mean, they're underserved countries, and there's a definition by the World Bank how these countries could be seen. And if you look back, we had touch points. I'll give you some numbers here. 2 years ago, 147 million. Last year, 174 million. And our target is to go in the next years to 220 million patient touch points. As a company having that target, that also means you need to find ways to approach these markets. One way is dedicated products fitting the market needs, which is part then of our development roadmap. The other way is finding ways like PPPs to bring that private expertise into the countries. One example there. Another example is that we are also contributing to a regenerative and health environment, and we have set ourselves clear net CO2, carbon reduction targets as a company, which we want to achieve. And actually, one of the first successes, which I'm really proud about, is that together with the University of California in San Francisco, we have created the first carbon neutral radiology imaging service. And that might be of interest also to now the countries who are striving for the SDG goals. And as Natalia was saying, we were behind, or we are behind, to quicker solve that gap and close the gap.
It's interesting that we keep talking about being behind the goals. Do you think the goals were realistic when they were set, or do you think they were always too ambitious? Natalia, to you first, because I know you've done some work with some of the world associated with PPP.
Well, it's a tough question, Richard. I mean, I would say yes. I mean, everything is possible. It's just the question of effort, dedication, and commitment. So, and some targets were, I think, achieved. We were on the good track, and then pandemic happened. So we were, of course, lost time, lost resources. So, but I strongly believe that they are achievable. It's just the question of commitment and making sure that we act as one, private and public sector together. It's not just the mission for public sector. And I think this is was a mistake to kind of keep the business on the side of this very important exercise. But I think with UN Global Compact, where more and more businesses join this route, I think we are on the right track.
Thank you. Renas, you mentioned that on your development with the university in the US, you've gone to a carbon neutral, I can't remember what it was now, apologies, but you went to carbon neutral piece of technology?
No, it's the whole imaging service. So a carbon neutral radiology imaging service.
So how do you assess the carbon usage? How far down the supply chain do you go in order to calculate the carbon that you're now saving? Because that must be an incredibly complex problem.
Right, and we have a strong partner here with us, which is Siemens Smart Infrastructures. And they are measuring and tracking the energy consumption via smart meters. And then we have also introduced our new scanner technology there, which is greener, lighter, and smaller. And also faster in terms of having more patients throughput during the day, so that also per patient that energy consumption is reduced. But sure, I mean, a solution which is taken is that we are providing renewable energy certificates, which is then provided by Siemens Smart Infrastructure to UCSF.
And with this new technology, can existing medical people just adopt it, or do they need training and coaching in how to use it to maximise the benefits? And how do you deal with that when you're working throughout the world with making sure there's competent people working alongside you and alongside the technology?
That's a good point you're touching there. So it's let's say, take an MR technology. The users know how to operate an MR, and after basic training, they can do that. But to get the maximum out of the machine, I believe we can do more. And that's also, in my view, something we can add into PPP projects, that long-term education to have a higher return from the investment which is taken. And that education, you might say, is on the machine only, so using all the software features which are there on today's modern machines. But I'm actually going beyond that. It is also the operational workflow around the machine, the clinical relevance, the routing of patients in the hospital, the whole clinical pathway analysis, and then maybe setting up in a different way because newer machine or diagnostics are available. And that piece today is typically not part of a PPP. It has to be purchased later. Or that knowledge has to be acquired by adding people with that competence into the organization of the customer. But what we are doing now with value partnerships, that we are able to offer that to a broad set of customers to go that route.
Thank you. Natalia, Renas is talking about sort of education, particular education to do with the technology and the solutions that you're rolling out. But do you think the benefits and risks of PPPs are understood by project promoters generally, or do you think this whole thing about they look at just part of it and don't forget that wider, for want of a better word, ecosystem of the training and the development of the people involved in it? Do you think there's more that needs to be done in that area?
Thanks for the question, Richard. I think largely they understood, of course, the risk and benefits. We're dealing with very professional and competent people, but there is always, of course, room for capacity building, for sure, simply because the world is changing, and we have new risks and new benefits to consider. And for instance, climate resilience and adaptation is the topics which dominate current PPP discussions, and also how to manage technology and innovations over the long period of time. This is another very challenging question. And how to generate values for the communities, the value for people. This is something which classically we don't consider in the PPP metrics, but this is something which is nowadays considered must to have. And I think there is always an opportunity to develop sector-specific educational program. I think this is also there is a gap there. We have a lot of general trainings, but I think if we develop tailor-made sector-specific trainings, for instance, if we talk about healthcare, of course, we have different models, we have different stakeholders, different types of funding. I think it would be very beneficial.
Thank you. I mean,
I may add, you talked about complexity of PPPs. It's huge. It's really complex, both for the government, but also for industry. And if you look at the typical setup in a greenfield environment, you have the construction and facility management companies dominating this. And depending on the country, they have healthcare experience or not. And if then the, let's say, MOH, Ministry of Health, is putting out that PPP project and does not have a rigorous qualification process, you might end up with 5, 6 entities competing for that project, which is, in my opinion, not efficient also for the MOH. And for us, the complexity is there. How do you bring that value into the discussion? And that's part of the education again, which Natalia was referring to, so that the companies who are locally strong but with a construction or facility management background understand that value creation in the healthcare business. And that makes it, that complexity of the different partners, of the many players in that field makes it complex.
Renas, that's something that's very, very close to my heart. I come from a construction background, and you very, very rarely find people who understand value. It's always about price. They talk about best value, but ultimately it seems to come down to price. And I think that education of clients and people throughout the purchasing business, throughout the supply chain, procurement, is just so difficult, because how do you value someone's expertise and track record against someone with a lesser expertise and track record, but at a lower commercial price, because they don't understand the risks? And I would imagine that in the field that you're working, 220 million patients touch points, trying to address the care requirements of organizations around the world. Your expertise and knowledge must be so valuable to that company, that country. But if it's all but we've only got this amount of budget and the budget's insufficient, that's a huge dilemma. I don't know the answer to it, but it's every time you read sort of construction reports from any country in the world, it's all about best value, maximum value. But ultimately, how do you judge it?
I mean, it would be a start to have that as part of the tender process, to not look only into the initial setup and purchasing price and the keeping the facility alive, let's say, on facility management perspective, but also look at suggestions how to increase the use and increase the return from that facility over time.
And that's why, Rechid, we actually come up with our own approach, what we are offering to our partners and clients. It's a combination of three factors. It's value for money, which is classical for PPP projects, then value for people, and value for innovations. And then we think this is the key, ingredients which make the project successful. So it's not sufficient to have only value for money. And that's why we need to educate the governments, and they have to design the procurement process in a way that these three components are properly taken into consideration.
Fascinating. Absolutely fascinating about that whole procurement model, as is important as a technical solution, and as is important as the care to the community. I mean, we had an interesting project that we won for the World Bank, which was through competitive dialogue, which I thought was actually a really useful way of drawing out from all partners what you were going to bring to the party. It took quite a lot of time, but where you put forward a proposal, you can then discuss it. You then get sent another set of questions to answer based on all the replies that people had. It was quite a long process, but a really valuable process of nailing down precisely what value you would bring to the organization and to the project. So yes, I will have to remember those three values. Thank you.
We will remind you, Richard, don't worry if you forget. But I think PPPs are not price driven. I mean, at the end of the day, they are delivering the very important, in our case, social projects. I don't want to talk about other sectors, but we're talking about healthcare. I mean, what could be more important than healthcare and education? So it's definitely not sufficient just talk about price-driven procurement construct.
Renas, with your background, I've read quite a lot recently about project data analytics and digital twins. I confess I don't understand the detail behind these, but I just wondered that with the Siemens Group technical expertise, are you sort of using the rest of the Siemens Group and your knowledge to bring these leading edge techniques to your PPP and Greenfield hospital projects? So are you using a lot more of the data that you've gathered over time? And do you use this concept of a digital twin?
Yes, Richard. Thank you. Nice, nice transition. The digital twin, actually, we're using that in two areas. One is digital twin of the patient, which is more linked to the equipment, the imaging, the diagnostics, etc., and planning therapies on that patient. The other digital twin is actually of the operations. So when let's say you are designing a new building and you're designing an OR or a radiology department, that digital twin would take that layout and we assign staff allocation, patient times to the different process steps. We're looking at the number of installed equipment, and then we let that patient volume, which is planned for that infrastructure, run through it. And then you could do a stress test on that infrastructure by having more or less space, more or less equipment, more or less staff, accidents in the area. So suddenly a flush of patient is coming in. And with that modeling in a digital twin, simulating workflows, you can fine tune your future building and you understand what are the limitations also going forward.
It's fascinating. So it's really building the prototype of a hospital before you have to commit to putting any physical infrastructure or buildings in place.
Yeah, and Richard, you could physically walk. You could use the the virtual reality tools, and you could physically walk through the building and see whether it makes sense for you in terms of workflow, and does it make sense also for the patients. It's amazing technology.
So how long does it take to build a digital twin of a new hospital?
A new hospital, we have not done that yet. And also you don't need to model the whole hospital. You need to model critical areas. And these are typically projects which run a couple of months, from data gathering from the existing sites, then the modeling for the future site, which has been assumed. You need to make sure the plans are ready. And as you go through that and you talk to the initiators and the users about modifications until you have a final result that takes a couple of months.
It's as quick as that. I mean, that's amazing. So within a calendar quarter, you could engage with a client, you could build a representation of the key elements of what they're trying to procure, and you could actually let them walk through it to see what they're going to get.
Indeed. The walkthrough is actually the easiest piece of it. The modeling around it, so getting that data assigned to procedures, to staff levels, is the piece which requires the investment time.
Renas, I'd like to come back to something you said earlier about the digital twin of the patient.
Yeah.
Do you run into the dreaded GDPR laws on this thing about what information you can and you can't hold on a patient? Is that a challenge for you, as you want to be able to do the best for the patient in terms of using the data, but the law of GDPR starts to make it much more difficult for people to use data?
For that initiative with the digital twin, not really, because first of all the products we have are fulfilling the GDPR requirements. Yes. Also, if we have cloud-based solutions, they fulfill that. And as the system are getting deployed, it's in the hospital the use, and the hospital has all the rights to use the patient data according to their treatment contract. It's not a model that you have a digital twin somewhere in the cloud and everyone can access it. That's not the model to go forward. If you look fully at eHealth, those systems and the whole eHealth infrastructure fulfills GDPR requirements. And you've seen countries going in that direction and are fully deployed, like Israel or Turkey. You have an eHealth record on the country level. So the nations are going that direction. What we are saying, a digital twin is also when you take a CT or an MR and you have a 3D model of the organs of that patient, and then you look at the potentially cancer treatment. So how does the beam has to go in that infrastructure? It is the personalized twin on which you're doing the planning.
Thank you. So, Natalia, having joined Siemens Healthineers, what would success look like for you in about 3 or 4 years' time? What was it that, I'm putting you on the spot here, what was it that attracted you to the role? and what do you hope to fulfill over, say, the next 3 to 4 years? So if we're having this conversation in 2025, what would you be most proud of achieving?
Well, I'm a PPP enthusiast, so I'm very proud and happy to join Siemens Healthineers. I think it's a great privilege to be a part of such a excellent team, very competent, very nice people, and I'm quite enjoying working there, to be honest. And I see how much competence is there and how much this competence changing the people's life. And for me, this is the biggest motivation. So in terms of public-private partnerships, as we discussed, it's just another modality to deliver value for patients. And I would hopefully, I would like to see increased PPP funnel, especially in the countries which are only exploring this route, and would definitely would be interested, especially in developing countries. We could name countries who are only launching now PPP pipeline of healthcare projects, and I would be happy to see these projects, of course, realized.
Thank you.
And be part of them.
And Renas, you have a target of, I think you said 220 million patient touch points. In 3-4 years' time, what do you think that could possibly grow to? What would success look like for you in 2025?
In that PPP arena, it is not only winning deals, being part of deals like Natalia said, increasing the funnel, and having the discussions with the countries and the PPP bodies. Achieving those 220 million touch points is definitely something we are driving. But success for me would also be if that concept of getting the value into that PPP discussion would be great, so that we see tenders which take that into account. Take an example. Let's say you have a new hospital. They plan with, let's say, a larger one, 200 pieces of equipment in there. And among those, let's say there are 3 CTs. And the plan they have is to use an average exam time of 20 minutes per CT. That was the planning assumption. Now, if we would re-look at those, and if we take global average times for examinations, we might be able to say, why don't you keep 2 CTs in the imaging center, but you move 1 into the emergency department, so that your stroke treatment is improved. You can still cover that volume, but the patient flow will be better. And at the end, the serving the society, looking at long-term disability impact, is improving. Yeah, and this is the value discussion we would have. In traditional PPPs, you would deliver the 3 CTs and you're done, right? And now it's more the question, how do you deploy them best? How can you make continuous education that you reduce the average exam time to free up 1 of those equipment, potentially, and then have a better service to the patient? So
the way you describe it, Siemens Healthineers is really a total solution. It's that engagement with the country, with the healthcare providers, to actually work with them to maximise, as you've said several times, value and innovation. It's not just let's sell it in, build it, charge a fee. It's actually how do you work jointly and collectively with your clients to maximise health for the community. Fascinating, absolutely fascinating.
That approach we launched we have been doing that for many years, but we have been actively pushing that now since a couple of years. And with the concept of the value partnership, expressing that interaction with the customer and generating that value instead of, as you say, just deliver, keep the uptime and train upon installation, but also looking at the impact of that investment and how can you maximize that.
And this, Rechid, what attracted me to Siemens' business model, because it's transformational. It's not just we sell you equipment and we are done with this. So it's really it's much more behind. It's like the top of the iceberg when you could find so many exciting things in technology, the digital health solution, education. It's a real package behind.
Oh, it's fascinating. Renas, Natalia, many, many thanks for finding the time for this conversation with me. It was really, really interesting. It's a technology and a business area that I'm not very familiar with. And I have to say, I'm amazed at some of the ideas that you have and some of the thoughts and concepts you're going to bring in. And no doubt it will flow over from healthcare into other business sectors as colleagues within your wider group actually see what you're doing and think maybe there's a better way for that transformational partnership activity to work in other areas. So thank you very much for spending the time.
Thank you, Richard.
Thank you, Richard. Thanks a lot for invitation.